Hi everybody, Kate here, one of our physical therapists at our East Norristown location, here to talk disc herniations. What are they? Why the heck does everyone have one, and what do I do about it? Okay, so a disc herniation, the very simple concept. We have our spine is a bunch of vertebrae stacked on top of each other, okay? In between each of those vertebrae is a little disc. Okay, the disc acts as sort of like a shock absorber. So those two vertebrae are not directly on top of each other. It takes up a little space, takes some of the shock that comes up from the ground as we're upright and walking around. Now, the discs are, for a very vague explanation, are kind of like a jelly donut. Okay, in a sense that it's a disc shape and it has a little bit of like a gelatinous material in the middle of it. If you have a jelly donut, which is kind of a similar shape, you pinch on one side of a jelly donut, jelly goes out the other side. Now, again, for just the purpose of understanding this, I use the jelly donut analogy. It is much more complicated and much more difficult to herniate a disc outside of just putting a little pressure on one part of the disc. But again, for the sake of just kind of understanding how they develop, the jelly donut analogy works well. So like a very common thing we hear as physical therapists, or I'm sure you've heard your neighbor, your uncle, your brother, whatever, they go to pick something up, they go to pick it up, and maybe it's a little heavier than what they thought, and they feel a sharp stabbing pain. They get electricity down the leg, burning hot, red, irritated, okay? And then for the next couple of days, they are out of commission. They can't move, because what has happened is, as they have bent forward to pick that thing off of the ground, they have created an excessive amount of stress on the front part of their spine as they bent over, okay, which has in turn created an appropriate amount of stress on the front part of the jelly donut for the jelly to go out the back. When the jelly goes out the back, our nerves, that's where our nerves exit our spinal cord, which is why when that jelly pokes out the back, you get the pain down the leg, some numbness, tingling, maybe even feel a little bit of weakness in the leg, okay? So just so you can kind of get a picture, a visual representation, okay? So here's kind of normal alignment of your spine. Everything's stacked on top of each other. And if you look, this space is equal to this space, about, okay? This space looks just about the same as this space. So that means that the stress on that jelly donut is equal on either side. Now, if you're bent forward, so this would be the head, this would be the arms, okay? If you're bent forward, then again, you can kind of see how this space now looks a lot different than this big space back here, which means that the jelly donut in here is going to be squeezed from this direction, and then everything's going to start to poke out the back, okay? So this is generally how this gets formed. Now, this can be from traumatic thing, lifting, reaching, twisting, like lifting something up from the ground or something like that. More often than not, people don't necessarily have trauma with a disc herniation. They'll have maybe some chronic recurrent low back pain that, this most recent episode, it has been way worse than it ever has been before. And I didn't really do anything different, right? That's sort of the classic presentation of a disc herniation, in a sense that, maybe 20 years ago, you had a little herniation because maybe you bent forward to lift your kid up off of the ground, and you had a little disc herniation, you rested a little bit, went away. And then maybe the following year you went to lift a bag of, leaves from the ground and put them in the trash can. Same thing, little herniation, went back after a little bit of rest. And these little instances keep happening over years and years, but it always goes away until it doesn't. And that's usually when you come to see a healthcare provider, because then at that point, maybe you've got more pain down the leg, maybe numbness, tingling, maybe even a little bit of weakness in the leg that you're concerned about. But understand that presentation is very normal. I would encourage you to get to a physical therapist on that second episode or the third episode, even if it's not bad, to help get ahead of it, right? It's always good to be proactive with taking care of your body as opposed to reactive until, it's been 20 years, you've had 10 plus episodes of low back pain, and again, now your foot's numb and you're having difficulty moving your ankle. obviously in that instance, it's way harder for the healthcare professional to be effective as opposed to if you got it addressed on the front end when it wasn't that bad, okay? But again, generally speaking, disc herniation, a lot of pressure on the front part of the disc, which pushes it out the back, okay? Now, trauma can do it sitting, posture, okay? We are all guilty of sitting like this, right? And if you can appreciate what your spine looks like in sort of a forward slouched position, my spine is curved. All of the pressure is put on the front part of my disc. And it may not be a lot of pressure at first, but that accumulation and that repetition of stress always on the front part of your disc, that is what creates more of a chronic disc herniation. So the number one thing I can tell you to do to help navigate a disc herniation, get up. Anyone who's works from home or works at an office job, every hour you should be up for at least 10, 20 minutes, okay? If you have an option for a standing desk, even better. Second thing, if this stress on the front part of the disc is what is creating that pressure, the other direction, okay? Start to stress the other part of the disc, the back part of the disc, with the goal of trying to push that material back in, okay? This exercise 2-3 times a day, especially if it feels particularly stiff or sore. Extension, okay? Another great exercise that you can do before you even get out of bed would be a press up. So that would be here, and you are pushing up and down, okay? And again, the goal of just trying to start more consistently stressing the back part of the disc, okay? The more you can do that exercise, the better. So I usually recommend patients, morning and night. Before you get out of bed in the morning, before you fall asleep at night, you do a set or two. If you can fit one in the middle of the day, great. Otherwise, these guys are great to be doing on a regular basis, okay? Now, there's a lot more specificity with the diagnosis, and sometimes people need a bit more of a specific exercise prescription than just do this a couple of times a day. So if you give that a try and you're having issues, it's not going well, it hurts, give us a call, okay? Otherwise, good luck.